This is Belial. Belial just came in today. He walked in, actually. So this is as reality as it gets. This is his first visit. Never met me before, have you? We didn't rehearse anything, did we? Okay. For all I know, he's going to scream and be mad at me and tell me he'll never coming back, and it's all going to be on camera. It's going to be horrible. No, that's not going to happen.
No, it's going to be fine.
Yes, we started out by doing a scan, a surface EMG scan. We took a consultation, got a history. Belial here hurt his low back. He went on an extensive hiking trip, and ever since then he's been having a hard time with things. Mm-hmm. So came into our office, and one of the first things we do upon getting a good history is a surface EMG scan, just like this. This is Belial's surface EMG scan that we took. On it, there's some readings. He gets to take this home today. When we look at things, what we're seeing is we should be green throughout. That's normal, green. What ends up happening is we start to see different colors based on how things are being affected in the different muscle tension associated with misalignments in the spine. So T1 seems to be reading red pretty bad, the base of the neck. That wasn't necessarily what he came in for, but we see this kind of stuff all the time. It's not just based off of pain, it's how that's aligned. And if it's misaligned and it has pressure on a nerve, it's not always the part of the nerve that controls pain. So we may have that might have been going on for a long time, you didn't even know it. It's just one extra thing.
Could the issue with the lower back be related to the
absolutely
upper neck stuff?
And what's even cooler about everything is we just took the films. I haven't even seen them. Okay. I'm going to show you for the first time, and I'm going to see them for the first time, all in one shot. We'll match this up with the x-rays, and we'll see. We'll give you your first adjustment here in a second. The main point I'm making is there's two big findings on this scan. One is everything is from the upper back down lower normal or lower than normal. So the muscles are weak. This low back has been going on for a long time. It wasn't like your hiking trip did it all. That's been going on for a while, and that was just one extra thing that took it over the edge.
Is that because of me lurching, like leaning forward on the incline?
That's not helping you. Weight distribution with all the gravity coming down doesn't help the situation. But what we're going to see is this is probably something that's been going on for a while. Okay. The other finding is that everything from the mid-back down is all pointing to the left.
Right.
And everything from the neck up is all pointing to the right. We're looking at a symmetry difference. It's changing your posture. It's causing problems, and what's happening down low may have done this. We'll find out here on x-ray in a second. But 99% of the time with a scan like this, you're going to see a curve here in the x-ray, and we're going to see that. It should match up. Okay? One of the first things I do in the exam and with the first adjustment is I use a nervous scope. This is different from the scan. The scan measures muscle tension. It takes a while to change that. It's like working out. I can't change the muscle tension pattern and symmetry in one visit, so we do that every 12 visits. That's a good indication of the progress we're making. This is different. This measures temperature difference and swelling in the spine. This is going to make a big reading with the needle. So when we look at this, the air is different than my finger is warmer, so it's going to bring that needle way off to the side. When I run that down your spine, it's going to do the same thing if there's a pressure on a nerve that's controlling that heat flow to the skin. It's just evidence, and this changes every visit.
Okay.
That's the difference between the two. Okay? So this particular instrument is called a nervous scope. We use it in a technique called the Gonstead technique, and it's a thorough way of seeing if and when you need to be adjusted and where.
Okay.
Essentially, it's the only tool that's going to tell us, hey, I don't need to adjust you there. It's going to avoid me from adjusting you in areas you shouldn't be adjusted.
Which is more accurate, nervous scope or?
They're measuring two different things.
Two different things.
So this tells me each visit what I should take care of, what I should leave alone. And this tells me each visit, every 12 visits, the progress we're making.
Gotcha. Two
different things. Yeah. Okay. Good. So if you don't mind, I have to take your shirt off for me. We're going to scope you up. Good. Have a seat. Good. Just lean back for me. Good. I don't know if you can see this, but what is your daughter's name again?
Saudia.
Saudia is in the corner coloring here. She's trying to be nice and quiet for everybody, and that's fine.
Say hi to the camera.
She's doing so good. She's very well behaved.
Thank you.
And she's in kindergarten, right?
kindergarten, right?
Go straight ahead.
Sorry.
That's all right. Stand or sit up straight forward. You didn't know when you were walking in here you're going to be on camera, did you?
I was prepared for anything. I'm always prepared.
That's good. Okay. And so there's no radiation with this. This only takes a second. It really doesn't do much as far as the adjustment goes. But it's telling me where the areas of concern are. There's one right down here, and I'm taking you through a little bit of motion here to see why that scope is reading down there. Feeling the joint range of motion in here. And what's going to happen right here is that very tender right there.
Yeah, I mean, that's right on the bone itself, but all in that area is tender, and it sort of radiates from that point.
Does it radiate off to the side or dead center here?
Off to the side.
Off to this left
Oh,
side?
oh.
Yeah. Ooh, right there. Okay.
So is the temperature a lot warmer down there, or?
It's different between the right and left side.
Okay.
So it's not normal. It should be even on each side. According to that level.
That's a pressure
spot.
point, I guess you would call. I don't know
Right here.
the medical term, but yeah, that hurts.
And that's that last vertebra, we call that L5. The other one that showed up is right here, and that's that red mark on that scan. Right here, T2, actually. Okay? Good. I'm gonna do a few things real quick, just to see what we're looking at, finish up the exam, okay? I want you to look to your right as far as you can, back to the center, to your left. Okay, back to the center. Any pain with that?
No.
Did you notice this side was a little less?
In terms of range of motion?
Yep.
Yep.
Okay. Ear to shoulder sideways. There you go. Oh, back to the center. That was bonus. We'll charge you for that one. This way. Good. Did you notice that one was less too?
Yeah.
All left-sided less, right? Good. Okay. Chin to chest. Back to the center. Any pain with that?
No.
Back extension all the way. Did that
What
get
do you mean? All the way back?
Yeah. Does that hurt you at all in here? No. Good. It's more the low back kind of stuff. So if I were to sit you up like this, without the work of your shoes, if you were to just bring your knee up for me with all your strength, does that hurt your low back?
Not so much.
Good. Does this one?
Yeah.
That one gets you.
Mm-hmm.
That one aggravates at that left side. That's a positive finding, and that tells me that last vertebra got some pressure on that nerve. It's affecting the strength of that leg. It's affecting a lot of things.
Mm-hmm.
Okay.
You saw me when I sneezed.
Yeah.
I could have fell over.
Another positive finding. Belial sneezed and kind of just fell over. That's a positive sign of the pressure in that nervous system as well.
A week ago, I would have actually fallen over. But
go ahead and sit up straight for me. I'm just going to take you through a couple ranges of motion. When I do this, does that aggravate it? Oh, that was bonus. Is that aggravated? No. Probably feels better now, a little bit. And this way? No. Okay. Forward this way? No.
That hurts.
That gets you. Okay. And this way? That gets you.
Not so much.
Okay. All right. Now I'm going to just show you the x-rays because I know exactly what I'm going to adjust at this point. I'm going to explain what it is and how I'm going to do it. So
it won't be the whole deal. It's going to be focused on these problem areas.
I'm going to be going ahead and I'm going to focus on this part
Gotcha.
and the low back.
Gotcha.
We give you a brief explanation of what it is, and then next visit I'm going to follow up with a full explanation of the extent, any degeneration that's going on, any further problems. But let's look at it.
Cool.